eQuez. Your quest for education starts here. Welcome to eQuez Audio.
Hello, everybody. I'm Margaret Feldman, the founder of eQuez, a platform that helps students discover careers, find best fit schools, and make smart choices about higher education. This is episode 8 of Inside with eQuez, where we take an inside look at the journeys and lives of students and professionals who are studying to enter or work in a particular career. Today, we are speaking with Dr. Alton Johnson Jr., a chief resident of Podiatric Medicine and Surgery. After listening to this episode, if podiatric medicine sounds interesting to you, visit eQuez.com, that's eQuez.com, to get connected to best fit podiatric medical schools. Dr. Alton R Johnson Jr. is the current chief resident of Podiatric Medicine and Surgery at a 3-year residency at a level 2 trauma center in Miami, Florida. Dr. Johnson attended medical school at the Kent State University College of Podiatric Medicine in Ohio. He completed his senior medicine rotation at Metro Health Hospital, a level 1 trauma and burn center in Cleveland, Ohio. Dr. Johnson received his Bachelor of Science degree in biology from Barry University in Miami Shores, Florida. Dr. Johnson specializes in trauma, limb salvage, plastic surgery of the lower extremity, podiatric dermatology, regenerative medicine, wound care, peripheral nerve surgery, geriatrics, and sports medicine. Now, let's hear from Dr. Alton Johnson Jr. Dr. Johnson, welcome to our show. We're very excited to have you.
I'm excited to be here. Thank you for inviting me.
Sure thing. Well, let's just dive right in here. So how did you first learn about the field of podiatry?
That's a great question. I actually went to undergrad, which I went to Barry University that actually has a podiatry school, one of 9 podiatry schools. But trust me, at the first year of college, I think I would be a foot doctor. And I was like, no, I was a pre-med major. I was like, I'm not going to do like clipping toenails. This is like not fun. Yeah. But I had a couple of friends that were in podiatry school and they're like, oh, you should check it out. And I never checked it out until I graduated. So I actually graduated. I did a year at AmeriCorps. So I actually worked at an HIV clinic out in Baton Rouge, Louisiana. Okay. And when there, they had a multi-specialty practice. We had infectious disease, internal medicine, dentistry, podiatry. And then I ended up hanging out with the podiatrist there, and he was doing all types of cool stuff. He wasn't just clipping toenails. He was actually doing like bedside procedures for the patients in the clinic. Okay. A lot of diagnostic, even like diagnosing skin cancers and things. And I was like, this is fun. I was like, he has a patient variety. So I was like, let me look into it. Kind of shadowed him some more, talked to some people and see if it was worth the investment, and took it from there. Okay. And believe it or not, I actually ended up not choosing the undergrad school that I went to for podiatry school. I actually ended up going to Kent State out in Cleveland, Ohio. Because that was a school that kind of stood out to me a little bit better than that one, just for my personal, because I already lived in Miami. Sure. I was like, let me try something different, see something different. And sure. And it was the older schools too, so I took it from there, and that was it. I was intrigued. It was fun.
Okay. And did you shadow just the one doctor you saw, or did you end up shadowing multiple podiatrists?
Actually, believe it or not, so he was a twin brother. I shadowed his twin brother who was in private practice. He was for the government. That was like a government-run clinic, but his twin brother was a private practice. So I shadowed those two, and I was like, it seems like it's worth it, and took it from there. Yeah.
Cool. And did you ever consider the MD or DO route?
Oh, yeah, definitely. When I was in undergrad taking MCAT, because you still have to take the MCAT for podiatry. A lot of people don't know that. It's not GRE. It's definitely still MCAT. So, yeah, at the time when did I take the MCAT first? I think I took it first when I was a junior in college, and it wasn't the greatest score. So I was like, this is not going to work for med schools or probably wouldn't even work for podiatry school at that time. So I was like, let me take it again, and then I'll see see where it falls, and apply to both MD, DO, and DPM at the same time. I think I had like 1 or 2 interviews with MD, DO, then like 3 or 4 with the DPM. And after that, I was like, because the thing is the biggest thing too is I realized that I wanted to do surgery. I didn't want to just be an internal medicine doc. So that was one thing too. And I was like, it's very competitive, especially if you want to do like orthopedic surgery, like we get to do with podiatry. It's there are not even that many residency for it, for MD or DO for those programs. Not accredited them, which kind of makes it better, I guess, for them. But so I knew that. And I was like, even if I end up getting into a school, I still have to be very competitive to get the residency I want. So I took it from there. That's one thing we love about our DPMs is we get the guarantee it's the surgical residency
Yes.
after you complete the degree. So
that's a big pro for students.
So yeah, definitely consider it. Yeah, that was the biggest thing is if any students interested in like surgery, you gotta remember if you don't match it, you may end up doing something like ER, emergency medicine, internal medicine. If you don't match, you want to match, and that's one of the things you gotta take into account at
Got it.
the MDDO route.
Yeah, definitely good to know. And you kind of touched on this before with yourself, but do you think that there are any misconceptions out there about what podiatrists do?
Yeah, so it's an evolving field. I mean, I can get in. I do a lot of cool stuff. So I'll just try to address the question and I'll tell you the cool stuff I do. But yeah, okay. So there is a lot of misconceptions. First off, I could just say I've been in residency since 2016. I've only clipped 4 or 5 patients' nails. Okay. So that right there lets you know like what the profession's kind of evolved from what initially it was, which was chiropody, which is pretty much the palliative care of the foot. But we still do that. That's still important, especially for our diabetic patients. But that, and now, I mean, it depends on the state you practice in. Like in Florida, where I'm doing my residency out in South Florida, our privilege is for soft tissue procedures pretty much from the toes up to the hip. So there's actually some docs that do wound care of like the sacrum, which is actually pretty rare, but especially dependent on for podiatry. And for bony procedure, orthopedic procedures, we're allowed to do up to the tibia tuberosity. So that's why a lot of people like to distinct say, they're foot, ankle, and leg surgeons. Out here, that's what technically they are. I mean, there's other places I've been interviewing for jobs where all the podiatrists get to do is foot care, not even the ankle, whether it's a soft tissue mass on the ankle or anything. So that's one of the misconceptions is look at that state scope of practice. Florida has a really good one. Texas has a really good one. Michigan. I mean, a lot of states are starting to gear towards it. I know some pods that even out, depending on where they're at, if they're in a rural area, they administer their own anesthesia because they have to. They don't have an anesthesiologist on call at the places. So those taken account. You're definitely you're definitely a podiatric physician or a podiatric surgeon. I mean, I don't even, like some states don't even call it podiatry, and it's basically foot and ankle. I mean, it is what it is. I mean, a lot of people don't like it, but that's the way it is. The profession's evolving, and it's definitely worth the investment, so it's worth it.
Okay. And I know you're currently a resident, so what does your typical day look like, or what could your day look like?
I'm a third year, so I'm really lazy now. I'm not joking. So luckily for us, for third year, it's a little bit different. But I'll give you an idea of like when I was a first year. I mean, you come in for our program, it's not as crazy. Like some programs come in at 5 o'clock in the morning. Our day usually works at 7, ends at 7, and that's how it kind of goes, like a 12-hour shift. And depending on if you're on call, I have add-on cases. But yeah, you come in about 7, you check on the patient, make sure you sign out with the team. Especially depends if it's a team change. So if it was a Monday, the people on the weekend kind of sign out to you, and then most hopefully they're still on service with you too, so they can help you with those patients. You sign out, figure out what's going on, make sure no one's, white counts elevated, any of those priority patients you try to take care of, especially your post-ops, and you check out your rounding sheets, then you round your patients. Typically, if you have surgeries, you do your surgeries, then you round with your attendings who have to come see their patients, make sure everything's good, update them, and see consults here and there. I mean, so when I thought I was like, I'm going to be a podiatrist, it's like, on call at the hospital, we're just going to chill. No, not at least in my hospital, especially in Florida. I mean, right now our census is like usually even any specialty they probably have a census about 20. We have a census at 40 right now. That gives you idea. It's just because of baby boomers. I mean, South Florida. So, so typically your day is about 12 hours. But, I mean, you can be between 8 to 10. But you have, we all have those same limits, just like the MDDO residencies where you can't work a certain amount of hours. We kind of all keep that. I think it's 80 hours a week or something like that. But, my particular program, too, we're on call every other week first year. So I was on call every other week, which was intense. But that's how you learn.
Sure.
I know. That's how.
And is your third year different from like your first and second years of residency?
Yeah. So first and second year is about the same. Third year is a little bit different. I mean, so I'm the chief resident, so I kind of have to manage the we call it junior residents. So make
Okay.
sure that they're all good. First off with, with their personal issues, and then making sure patient management patient management, patient safety, things like that. So I'll kind of look over, but they still have that attending to watch over them as well. But I kind of just double check to make sure everything's good, and do a lot of scheduling. And then third year is really geared towards trying to figure out what you want in your next step, whether it be, like I said, orthopedic surgery, trauma surgery.
Mm-hmm.
That was the thing I was saying. I like soft tissue, so I'm a soft tissue kind of guy. So I like dermatology. I get to do a lot of nerve cases, which a lot of people don't know. Podiatry does that. We do nerve releases, all this pretty cool like neurology type stuff, using loops, and a lot of plastic procedures. So those type of things. Third year, you get to work out on like elective type procedures. So it works out. Yeah, like the first year is you getting all of the ER stuff that comes in. First and second year, ER stuff come in. Third year, you're getting the stuff that the attendings bringing in electively from their offices typically.
Oh, okay.
That's how it kind of. So you kind of like we call it finessing. So kind of finesse what you learned, but still I have a lot to learn. I'll graduate until June, so I'll be working until June.
Okay. And Dr. Johnson, what would you say is your favorite part of your residency and your least favorite part of the residency?
The favorite part is there being a third year. No, favorite part. I mean, so I guess my residency, every residency is different. It depends on where you're at in the country.
Mm-hmm.
Depends on your specialty. It depends on because ours is pretty trauma heavy. We're at a level 2 trauma center.
Okay.
So I guess the favorite part of like actual residency is actually, believe it or not, it's the journey. Like, so I don't mind the hard parts. I don't know. Like the hard parts is what kind of made me better. I mean, I don't know if it was easy. Then I know if I got out, I probably wouldn't feel as confident about things. So I guess I would say it was the ER call. I love the ER call, even though a lot of people don't like ER call. But it was fun. It was worth it. So that was my it was the favorite part. The least favorite, I mean, is there really a least? I guess the long hours. But I guess that's any medical profession, right?
Yep.
So you kind of accept it. And but yeah, there's times where you just want to be at home, but you gotta just push through it.
Got it. What would be advice that you would give to students who are just entering their residency?
Oh, so yeah, you definitely. So I can tell them because and I went through all of it. So the biggest thing is you have to put your ego aside. I mean, it's weird. It's like, yeah, you're a doctor, but you're a doctor in training, and then so you still have to kind of like be a student, but you have to be confident. It's weird. It's like a fine line between being confident and being a student as a resident. It's tough. Like even no matter what specialty, because we have to rotate on all the specialties.
Sure.
So I know what they're feeling. So you have to come in, with a level of confidence, but you also have to be able to be moldable. So So that's the biggest thing. I mean, I guess that's like anything. If you're doing like karate or any of those type of specialties or anything that's a special skill, you just kind of have to be like that. But as far as that, and read a lot, if you can read, like find time to read. And YouTube helps with a lot of that stuff. I used to like learn how to do like my physical diagnostic exams on YouTube. Everyone posts everything on YouTube. You could probably diagnose. I wouldn't tell because people go and do it, but you could diagnose just about anything. And you could diagnose some pretty difficult things via YouTube and reading. Okay.
Good to know. What has been your most memorable or rewarding experience with a patient?
That's actually good because I actually just wrote up a case. So the most rewarding or memorable cases. I had a gentleman. He's from Kentucky. He was out on vacation, a scuba diving trip out in Belize. So my program's out in Miami. So this patient, he was scuba diving. He was diabetic. He ended up getting blisters and ended up getting a flesh-eating bacteria while he was in Belize. He was getting treated there. So yeah, him and his wife had air ambulance out to our hospital because that was like the nearest that his travel insurance covered at our hospital before he could get to Kentucky. And I mean, his leg, it was his left leg, I believe. And his left leg was it was his right leg, actually, his dominant leg. So his right leg was pretty much from his knee down, all the skin sloughed off from the infection.
Oh my gosh.
Basically, we call it Vibrio or flesh-eating skin bacteria. Necrotizing fasciitis is like the diagnosis we call it. And so everyone was like, oh, this guy's going to lose his leg. And we're the like podiatric limb salvage team. As I said, so everyone thinks we're just doing foot. No, so we're doing a lot more. So this became like more like a vascular podiatric plastics case. And we took over as podiatry, kind of skin grafted him, brought him back. He stayed for a month, ended up flying back home to Kentucky and getting skin grafts there. And I actually just spoke to him and his wife, and he's healed now. I mean, there's a few areas on his foot. He lost 2 of his toes, but not that big deal to lose an entire limb.
Right.
And yeah, so he's doing well. He's walking. He has a little limp because he lost some of his tendons, but he's very happy. He still has his leg. I don't think he's going to be scuba diving anymore, but
yeah,
only because by choice. But that was like really memorable. I mean,
I'm sure.
We have 4 or 5 surgeries on that guy. It was tough, but a lot of people giving up. I mean, yeah, it would have been easier, easier for us, like as a healthcare management, to just amputate, but you have to give those patients, the chance to heal that limb, especially if that was just from infection. So that was one of the most memorable ones that I can recall.
Okay.
It's just recent, so it should be presented. I just applied to present it at a plastics conference, so hopefully.
Okay.
And that was with a podiatric case, but plastic procedures.
Okay. Yeah, that's a intense story.
Yeah.
Okay, so you are going to be finishing up your residency, and what do you have planned for the future?
So yeah, if you remember, I mentioned that I like soft tissue, so I'm actually looking at fellowships for diabetic limb salvage. So looking at a couple fellowships that affiliated with universities throughout the nation. So I'm applying there, and I have a couple interviews lined up. Nothing definite at the moment. It's still kind of early in the season, but also filling out a couple of private practices just to fill it out in case you never know. Sometimes there's an offer and you'll go with that, but that's the next step. But I like limb salvage. It's fun. I like trauma as well, but limb salvage I think is definitely it seems like that's the thing that I enjoy. That's my niche.
Mm-hmm. Okay.
But trauma's cool too, but you just have to be on call a lot.
Yeah.
Have to be ready at a moment's notice. So.
Yeah. So with the fellowship, can you tell students a little bit more about what that is? I know that's an optional route to take. Not all students have to do it. So can you tell us just a little bit more and why you'd want to potentially do one?
Yeah, so just like MDDO, they have fellowships. Like if you're internal medicine, you want to do infectious disease fellowship, or you can do a cardio fellowship if they want to be, they're internal medicine, they want to specialize in the heart, or if they want to specialize in pulmonary. Just so for podiatry, we have a couple. Now it's gaining popularity, but even when I was a student, fellowship wasn't that popular. But now fellowship definitely more popular, more mainstream. So it depends on what you want to subspecialize. Even though podiatry is already a subspecialty, you can even subspecialize into, like I said, more like nerve procedures, limb salvage, which is basically sort of like what I mentioned, that gentleman's case, just trying to save limbs. Because a lot of people, just not even general surgeons or vascular surgeons even know how to manage it from a standpoint, only just because that's just not what they do. So that's things you learn throughout your profession. And also you can do a trauma fellowship, or you can do we also have ankle replacement fellowship, so you can do ankle replacements, things of that nature. But so yeah, fellowship is usually the ones that I'm looking at are 2 years, but typically they're 1 year. But the ones I'm looking at are 2 years because they want publications with it. So that's typically why you extend it to 2 years. They give you a 12-month and a 24-month option. But fellowship is just basically if you want to have a niche, or you figure out that's something you want to be a little bit more competent at versus others. But yeah, back in the day, people used to just any physician would just go back and kind of learn that stuff on their own throughout their private practice. But now, luckily, there's leaders within our profession, even because some of those fellowships have the MDDO directors, even though they train podiatrists. So it works out perfectly and things like that. Yeah, one of the interviews I have out in Pennsylvania is actually led by MD. So we'll see. Mm-hmm.
Good to know. Would you recommend the field of podiatry to other students?
So yeah, I mean, especially if you're interested, especially if you like surgery, and if you like if you like being challenged, podiatry is definitely it. I mean, I thought it was going to be like a walk in the park, and it's just like any other person, just a student that think they knows everything. Yeah. But definitely a lot of pathology in the lower extremity, way more than most people can would fathom. I mean, it's just because walking is important, gravity. I mean, then you mix in with comorbidities like diabetes, peripheral vascular disease. I mean, it's very important. Definitely a needed profession. So, yeah, if you want something that's enjoyable and rewarding. Yeah, like it's very rewarding because sort of like I mentioned that one case, I have other cases I can mention. We'll be talking all day. If I could just different patients that I can remember, but it's very rewarding to see those patients heal and move on with their lives after.
Yeah.
Obviously, yeah, we just here just another part of the big spectrum of healthcare, but it feels good to give back to the patients, especially the baby boomers. And if you like geriatrics in the next 10, 20 years, not even 20 years now, 15 years, that's going to be podiatry is going to be it if you want to be with the geriatric population of America.
Good to know. So Podiatric Medical School is definitely a large investment in terms of both time and money. So what, Dr. Johnson, made you decide to make that investment?
So they're just like anything else. I always talk to my mentors, and I'm like, yeah, I mean, podiatry school, podiatry med school, dentistry, it's cheaper than dentistry. That's was positive because I have cousins that's in it. But it depends on what you like. You kind of look at it of what do you really like, and sort of like just someone sort of like mentioned the fellowship. Yeah, fellowship is almost like the same salary, maybe 10 to 20 more than what a resident pays, where you can just go out and probably get, double or triple that if you just become an attending status. But if it's something you're genuinely interested in, I mean, it's an investment into what you want to do as your career, your profession, how you want to prepare for your patients. So that's how I saw it as podiatry school, just an investment. I mean, yeah, it's almost the same price as a mortgage nowadays, but it's good. I mean, everyone does well. If you look at the projections of what is like the employee outlook books on the government websites, I mean, the profession's growing. And like I said, sort of the baby boomers will definitely keep the profession afloat for a couple more decades, which is good for that.
Definitely.
But so that's how I kind of weighed the pros versus cons. And I mean, do I look at my student loans every couple months? Yeah. Is it overwhelming? But push through.
Okay. And what advice would you give for students who are making that decision or who are considering podiatric medical school?
So yeah, I mean, definitely shadow. I mean, because now, I mean, yeah, you could become DPM, you can become DO, you can become MD. There's even orthopedic foot and ankle surgeons. You can see that how that's similar to podiatry, or how podiatry is similar to foot and ankle ortho. They kind of overlap depending on what they're doing. Some of the stuff they don't do that we do, and vice versa. So those things too, you have to kind of see what's worth it in the long haul. But also, yeah, you just kind of have to do some soul searching. That's the thing. It's you have to see if it's worth your time. Just even no matter if you're going to go to podiatry school or med school, that's really the biggest thing. But that's the biggest advice I can say is follow the doctors, talk to them, and there's some doctors that even show you how much debt they're in 10 years from practice. Some people didn't even have to pay for it, so it depends. Because even we have some places, some of our students have full scholarships when I was in school. If you had a 4.0, you could get a full scholarship, which is crazy. I don't know if they still do that in my school, but that's how it worked out. I was in a 4.0 though.
Yeah, you got to shop around because some schools do have.
Yeah. Some schools, when they open their first class, it's free. So, hey, if you can get it, please do it.
Yeah.
Really make it worth your time.
Okay. And Dr. Johnson, if students are interested in getting in touch with you, or if potentially future patients are interested in getting in touch with you, how can they reach you?
Yeah, so the best way is the Instagram. My Instagram is AJDTHE footdoc, FOOTDOC. So that's the best way. They can DM me, we call it direct messaging me, or post on one of my posts, and I'll get back to them. I have a couple of students. That even came by our program, the Shadow, their pre-meds. They didn't even know, they're like, oh, podiatry is cool. I'm like, we call it the best kept secret in medicine for a reason. Yep. And, but hopefully we get the secret out there. I mean, everyone should know about it. Especially if they want to utilize it. But yeah, it's definitely a lot different than 50 years ago what podiatrists used to do. Yep. My school was 100. The school I went to was 100 years old. I'm sure back then they didn't even have hospital privileges, so which is lets you know how the profession is growing. But that's the best way to reach me.
Okay.
AJ the Foot Dog.
Perfect. And last question, if you could go back to your first day of podiatric medical school, what is one piece of advice you would give yourself?
So I guess when I was, Let me think. So the best thing is, like, I used to reflect, like, even now, I'm like, oh man, I miss the podiatry school, or, miss podiatric medical school. It's because, like, I guess at that time I thought, this was the hardest step, and then you get to residency, it gets a little bit more harder, and then you become, getting ready to get out of residency, it becomes a little bit harder. Mm-hmm. So I guess the biggest thing I would tell myself is just trust the process, enjoy the journey. I mean, there's times when I used to complain because I lived in Cleveland and we get blizzards, and I'm like, oh, I have to drive home in the snow. Now I wish I could do that. Like, it's things those little small things that kind of add up. So yeah. I think, you kind of have to see it as like a journey. I think that's no matter what specialty you're in, whether, like I said, whether you're doing medicine, anything, just enjoy the process. So I guess that's what I would tell myself. Is even then there are some moments where I just would like whine. Now that I think about it, I'm like, there's no real reason I should have been complaining, because I was like fun. Yeah, it was fun. I was a full-time student, so that's fun. You get to learn all day. And I wish I had the time to study as much as I did.
Right. Good stuff. Well, thank you so much. I'm sure lots of students are, going to find your experiences and all your answers very helpful as they're making their decisions.
I hope they do. And if they have any questions, definitely, you can hit me up on Instagram or email me. It's Alton Johnson DPM at Gmail. Also look around. Instagram, there's a lot of pretty good DPM. Just like there's some pretty good DPM pages you guys that have that can show a little bit more patient information stuff that I can't, because they have the media releases. I don't have that many media releases because I'm still a resident, but once I start getting out there in practice, I'll have it. But those guys can release some of their patient profiles and show you some of the cool reconstruction cases that they get to do, and even some weird diagnosis, weird foreign bodies that we do out in our profession. Kind of like shows that we're doing a little bit more than what meets the eye.
Mm-hmm. Okay. Well, thanks again, Dr. Johnson. I appreciate your time.
All righty. Thank you for inviting me.
Thank you for listening to eQuez Audio. To learn more about podiatry and to explore schools, head over to eQuez.com. That's eQuez.com to get personally matched to best fit programs. If you enjoyed listening, be sure to subscribe, and we would love for you to rate and review us. Keep in mind that our discussion today mentions views and opinions that are personal in nature and do not necessarily reflect the official policy or position of any university, agency, organization, employer, or company, and should be used at your own discretion. We wish you the best in your quest for education.